Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les personnes suivantes prendront la parole lors de la séance d'information de cet après-midi. Le Dr. Jennifer Russell, médecin hygiéniste en chef. Le Premier ministre du Nouveau-Brunswick, l'Honorable Blaine Higgs. Speaking at this afternoon's briefing will be the following individuals: Dr. Jennifer Russell, the Chief Medical Officer of Health, the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Thank you, Bruce. Good afternoon, everyone. Bonjour à toutes et à tous. Before I begin, I would like to correct an error that I made during one of the briefings last week. I incorrectly described the Manoir de la Sagesse in Camelton as a shared room facility, and in fact, all residents are in separate rooms. And I'd like to apologize to the owner of the Manoir de la Sagesse for this error. I also wish to express my deep sorrow for the death of a resident of the Manoir Notre-Dame reported on Sunday. To the family, I extend my heartfelt condolences, and all of New Brunswick grieves with you today. La semaine dernière, j'ai affirmé que le Manoir de la Sagesse à Camelton est un établissement à chambre partagée. Or, tous les résidents du manoir ont leur propre chambre. Je tiens à m'excuser aux propriétaires de l'établissement de cette erreur. Par ailleurs, c'est avec beaucoup de tristesse que j'ai appris le décès d'une personne qui résidait au manoir Notre-Dame dimanche. Je tiens à offrir mes sincères condoléances à la famille de cette personne. Sachez que toute la population du Nouveau-Brunswick partage votre deuil aujourd'hui. This is New Brunswick's third death from COVID-19 since the pandemic began. In each case, the deceased was a resident of an adult residential facility, which is a stark reminder of the vulnerability of the frail and elderly to this disease and the duty we each carry to protect them. And by protecting them, we are protecting ourselves, because either it gets into a facility and then can get out into the community, or vice versa. Today, I'd like to talk about the measures we have taken to control the regional outbreaks of COVID-19 and set out the path for returning these zones to the yellow phase of recovery. Zone 1, which is the Moncton area, we are moving in the right direction. Since transitioning public health response to the orange level almost 2 weeks ago, we have seen a consistent downward trend in the number of cases and a significant decline in the risk of further infection. So the contact tracing has shown that all the infections in Zone 1 are related to one another, and the new cases that we have seen in Zone 1 over the course of the last several days have all been people who were self-isolating at home. So they were known to us, and we were aware of the risk of them becoming positive, and they were self-isolating at home, and therefore they could not transmit COVID-19 to any other people in that area. So barring any sudden change, because as you know, it's a 14-day isolation period, so we can continue to see new cases in the next over the course of that incubation period. And I am recommending to Cabinet that Zone 1 will be able to return to the yellow level of recovery, and that 2-week period would be roughly around Thursday, October 22nd. So I'll be bringing that to Cabinet to make a decision. So, depuis le retour à la phase orange, le nombre de cas n'a pas cessé de diminuer, tout comme le risque de nouvelles infections qui a considérablement baissé. La recherche des contacts nous a permis d'établir que toutes les infections dans la zone 1 sont liées les unes aux autres. À moins de revirement soudain de situation, je recommande au cabinet de permettre au retour à la phase jaune, c'était 14 jours de la suite des directions sur la phase orange. Ça serait dans la zone 1 environ jeudi le 22 octobre. So this is a testament to the people of Zone 1 and all of the work that public health has been doing to contain the spread of the infection. So not only the actions of the people within the facility at the manoir, but also the actions taken of the cases outside of the facility, along with all of our partners who have been helping with the contact tracing and isolating of potential cases. So I do want to thank everybody very, very much for their efforts in achieving this result, because it was not easy. However, I can't really make the same recommendation today for Zone 5. So the Hamilton Restigouche region, which is zone 5, is not going in the same direction. Pour ce qui est dans la zone 5, soit la région de Hamilton-Restigouche, je ne peux pas faire la même recommandation. The continued growth in the number of cases since putting into place the measures of the orange phase of public health measures, we are seeing continued transmission in the community, and we are seeing that people are not following public health directions. So we are seeing that people are not wearing their masks and they're not physically distancing. And the settings that we're seeing the transmission happen are in workplace settings where coworkers are not wearing masks and not keeping 6 feet apart, social settings where members of different household bubbles are interacting without masks and without physical distancing. So we are seeing this in multiple settings, so multiple workplace settings and multiple social settings and gatherings. So this means that we're continuing to see the spread of the disease. And some of the cases that we are seeing are not the people that were on our list of people that we were worried about who were self-isolating at home and therefore not at risk of transmitting to anybody else. So this is a huge risk for the region of Hamilton-Restigouche. And so at this time, I cannot make a recommendation around moving out of the zone, moving zone 5 out of the orange level of response at this time. I am asking everyone in zone 5 to redouble your efforts to slow down the spread of COVID-19 virus, and only you have the capacity to do that. And in fact, it is your responsibility and it is a civic duty to protect your community members. In particular, I am urging everyone in Zone 5 to limit your contacts. Keep to your 2-family bubble. We are seeing too many cases arising from family gatherings, social activities, as well as workplace settings. If you do this, I am confident we will have better news to report for Zone 5 in the weeks ahead. Today, we are reporting 3 new cases of COVID-19 in New Brunswick. They're all in Zone 5. An individual 19 years of age and under, an individual 40 to 49 years old, and an individual 60 to 69 years of age. To date, we have reported 313 cases of COVID-19 in the province, of which 103 remain active, and there are 4 individuals in the hospital at this time, including one who requires an intensive care. And just coming back to the difference between Zone 1 and Zone 5, we have roughly 57 active cases in the Hamilton-Restigouche Zone 5. And of those active cases, probably about 30 of them arose after the imposition of the orange phase of our restrictions and directions. So again, I'm really asking everybody with a sense of urgency, you must follow the public health directions so that we can turn this trend around. Stay 6 feet apart, wear your mask. Please don't interact with people if you don't have to. I'm asking you to keep the number of people that you interact with very, 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 very low. And I ask that you keep all of New Brunswickers and their families in your thoughts right now. Aujourd'hui, je signale 3 nouveaux cas de COVID-19 au Nouveau-Brunswick, tout dans la zone 5. Une personne de moins de 19 ans, une personne âgée de 40 à 49 ans, une personne âgée de 60 et 69 ans. À ce jour, il y a eu 313 cas du COVID-19 au Nouveau-Brunswick, dont 103 sont toujours actifs. 4 personnes sont hospitalisées à l'heure actuelle, dont une à l'unité des soins intensifs. Je vous demande une fois de plus de garder ces personnes et leurs familles dans vos pensées. I want to provide some further details on the process that leads to imposing or lifting restrictions during this pandemic. And I'm looking at my communications colleague about maybe we should have a plasticized version that you can put on your fridge. However, it is an evergreen document that will continue to evolve, so that wouldn't be practical. So you'll have to keep checking it as any updates are made around what we're doing with the different phases and what things are permitted and which things are not. Please be assured that our processes are firmly grounded in science and tempered by our experience and new evidence that arises as we manage this public health crisis, and that will continue to be the trend that we follow as things evolve. So they're not arbitrary measures. Our chief goal is protecting the health of New Brunswickers, and this includes your mental health, your physical health, our well-being with respect to all the social determinants of health, including our income and where we live, etc. Nearly 2 weeks ago, we transitioned Zone 1 and Zone 5 to the orange level because we saw a heightened risk of public exposure to the virus, instances of possible community transmission, and reports of low compliance with public health measures in some higher risk settings. Cette situation a constitué un recul dans nos efforts, jusqu'ici fructueux, pour protéger la population du Nouveau-Brunswick contre la COVID-19. Je sais bien sûr que ces restrictions nuisent à de nombreuses collectivités. Mais comme nous avons pu le constater, en particulier dans la zone 1, ces mesures ont une incidence positive sur la progression de la maladie. Depuis le retour à la phase orange dans les zones 1 et 5, nous avons mené des recherches de contacts exhaustifs et nous avons enjoint à des centaines de personnes de s'isoler, mettant fin à de possibles chaînes de contamination. These investigations have shown that all the cases in Zone 1 are related to one another, which gives us a better chance to control the spread. We feel confident that our measures have been effective in slowing the further spread of COVID-19 in Zone 1. I am in constant communication with the Regional Medical Officer of Health there dealing with the outbreak, and so we have touch bases with the epidemiologists, et cetera, around the information. And again, we are in a good place with respect to how things have gone in Zone 1 thus far. However, in Zone 5, the number of cases has not declined, and the risk of community spread remains a factor. So this is very, very concerning. It is a very, very different situation. And we are seeing many cases where the infection did occur at gatherings, in workplaces where, again, people were interacting without wearing a mask and without being 6 feet apart, and also in family activities. So that's why it's very imperative that everyone in Zone 5 take urgent steps to limit the spread of this disease and make sure you can really understand what orange level means. And if you can access our information on the website, then please do so and do everything you can to adhere to them. The actions you take will determine how long this outbreak lasts when restrictive measures now in place can be lifted. The last outbreak in the Campbellton region took 6 weeks to get under control, and it really is based on how quickly each individual takes actions to protect the entire community. If we are forced to impose even stronger measures to slow the spread of COVID-19, we will, and we have triggers to do that. And so that's why we're very concerned, and we're continuing to monitor the situation extremely closely. So COVID-19 is very, very prevalent outside of our borders, and we've known that this has been increasing over time. Since in the last 6 weeks, we've seen the numbers in Ontario and Quebec in particular go up very, very high in numbers. And in fact, they have fallen behind in their ability to stay on top of contact tracing. They have had community transmission. So the risks are very high outside of our borders. So it means that we all have to work harder to make sure that if it does get into the province, that we are not part of the chain of transmission, that we are not part of what is perpetuating COVID-19 in our province. If you are traveling regularly for work purposes, you are not required to self-isolate, but it is important that you watch for symptoms and voluntarily get yourself tested during your stay in New Brunswick. Some people have very, very good operational plans around work isolation. They have worked on these plans with WorkSafe New Brunswick, but again, we know it's a gap, we know that's a risk, and we want to really minimize that risk. So our goal continues to be able to have all of New Brunswick in the yellow phase of recovery for the entire time that we're in this pandemic until there's a vaccine. That is our ultimate goal, and that way we can keep schools open, we can keep the economy going, we can protect people's mental health, but we can also protect people's physical health. We know that when we're not in the yellow phase, this places a burden on the healthcare system in terms of having surgeries delayed, etc. We don't want that to happen. Despite this month's outbreaks, I do believe we are on the right track, but no one in any region of this province can afford to be complacent. So please remain vigilant and continue to wear a mask in public places. Wash your hands regularly and thoroughly and maintain physical distancing. And I have said to be kind, and when I say to be kind, I mean please don't jump to conclusions. Please give people the benefit of the doubt. Please don't bully people or post negative things on social media. But I also mean be responsible. Take care of yourself, but take care of your community, your coworkers, your family, your fellow businessmen. Everybody in this province needs your help right now. In our own ways, every single one of us needs support in coping with the reality of life at this time with COVID-19. Wearing a mask is important, but also being thoughtful in dealing with those who are not able to wear a mask for medical reasons or otherwise. I have heard that businesses are refusing admittance to customers not wearing masks, even when they have a valid reason for not doing so. Je ne m'attends pas à une conformité parfaite. Je veux que les gens respectent les règles, mais je sais aussi qu'il y a de nombreuses raisons valables pour ne pas porter de masque. Tâchez d'encourager vos concitoyens à porter un masque et de les renseigner sur l'importance de se protéger et de protéger les autres. Nous faisons des progrès importants, je vous l'assure. Pour continuer sur cette voie, nous devons tous contribuer à ralentir la propagation du virus. I offer my sincere thanks to each and every New Brunswicker who is helping to move us forward. Thank you very much.
Good afternoon. Bonjour. It was a very sad weekend as we all learned of the death of a resident of Manoir Notre Dame. On behalf of all New Brunswickers, I want to extend my sincere condolences to this individual's family and friends, as well as to everyone in our province who has been impacted by the recent outbreaks. This is the third death related to COVID-19 in our province, and this has been a challenging time for many of us. Our goal with the pandemic is to keep our province in the yellow alert level until there is a vaccine. Dans la phase jaune, nous pouvons vivre une vie aussi normale que possible. Les entreprises sont ouvertes et nous pouvons voir un plus grand nombre d'amis et de membres de notre famille. This is good for our province economically, and it's good for the mental health of individual New Brunswickers. The closer to normal we can function as a whole, the better across the board. When any zone returns to orange or the red alert level, that causes anxiety and concern for everyone, especially those living in the areas directly impacted by COVID-19. And none of us want this. C'est pourquoi nous demandons à tout le monde de respecter les directives de la santé publique. Nous devrons laver nos mains suivant respecter la distanciation physique et porter un masque dans les espaces publics intérieurs. Taking these necessary steps will help to keep our province in the yellow level. Taking the extra steps required in zones 1 and 5 will help those currently in the orange level return to the yellow level as quickly as possible. We have watched for improved compliance with public health measures, like wearing a mask in public spaces. Staff from the Department of Justice and Public Safety have conducted surveys in every region of the province. I'm pleased to see that we are actually experiencing very high rates of compliance with the mask-wearing mandate. 96% of New Brunswickers observed in public locations were wearing masks. This is compared to 36% prior to the mask being mandatory. With these actions, we feel confident that our measures have been effective in slowing the further spread of COVID-19, particularly in Zone 1. However, the picture in Zone 5 is less encouraging. The number of cases has not declined, and the risk of community spread remains a factor. But the most significant factor is contact between people in this community. For every confirmed case, there have been 20 contacts. Each one of these is being asked to self-isolate, which is having a negative impact on everyone in Zone 5. As Dr. Russell explained, for a region to move forward from the orange to yellow levels takes roughly 14 days, with targeted tracing and containment efforts. Based on the measures taken and the recommendation of public health, the Moncton region will move back into yellow level on Thursday, October 22nd. Ce passage de la phase orange à la phase jaune sera possible si les résidents de la région de Moncton continuent de respecter les mesures de la santé publique. For now, the Campbellton region will remain at the orange level, with the distinct possibility of further restrictions in the future. I know this is frustrating, but there are steps that everyone in that region can take to help us return that region to the yellow level sooner. The most important thing you can take is to follow the directions of public health. It is imperative at this time that you keep your social circles small so that contact tracing can be done as quickly as possible. Schools in the area have been impacted. Several industries have had to temporarily close. We need people to do their part to limit the spread so we can get the area back to yellow as quickly as possible. We need everyone just to think about more than themselves. I know the social activities and the demands can be high, but these can be temporary to restrict yourselves to a situation that reflects the urgency which we need you to follow in this region. We can return to yellow at some point in the future, and we want to do that sooner than later. So the actions of many, the actions of individuals, will greatly depend on the timing that will be allowed in order to get back to a normal life in COVID. In our continued efforts to ensure the health and safety of New Brunswickers, we are also looking at how to conduct tests for essential workers who travel. We'll have more details in the coming days on this, but everything is aimed at keeping New Brunswickers safe and keeping the virus manageable. Non-essential travel outside the Atlantic bubble still requires 14-day self-isolation upon return to the province. This pandemic and the steps we take to keep the residents of this province healthy and safe are constantly evolving. À mesure que nous en prenons davantage, nous allons continuer à apporter les changements nécessaires à la manière dont nous condamnons la propagation de ce virus. Ces décisions seront prises en partenariat avec la santé publique et selon les conseils qu'elle nous donnera. But the best advice can only take us so far. It is up to individuals to listen and take the steps we are asking you to take. Every New Brunswicker has a role to play in this. What we ask of you isn't really complicated at all, but it is important, and it is important to your neighbors and your friends and your relatives. Merci à tous les gens qui continuent de faire ce qui est nécessaire pour se protéger et pour protéger leurs familles, leurs amis et leur communauté. En travaillant ensemble, nous allons relever les défis qui se présentent à nous. Working together, we will come out of the other side of this stronger and more connected as a province. Thank you. Merci.
Merci beaucoup, Monsieur le Premier ministre. Dr. Russell, thank you, Premier Dr. Russell. Nous allons maintenant procéder aux questions aux journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Chaque journaliste peut poser une question et un suivi. We will now proceed with questions from the members of the media. Each reporter has the right to pose their question in the language of their choice. You will have one question and a quick follow-up. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for Dr. Russell. Dr. Russell, some New Brunswickers who live in yellow zones are uncertain about what the proper trick-or-treating protocol is for Halloween. If a household wants to give out candy, can you provide specifics on how this can be safely done?
I know we have all that information on our website. I think I have a few points around that here that I can share. But certainly in the yellow phase, informal and outdoor celebrations are permitted to a maximum of 50 people. Businesses, organizations, or groups that plan events such as malls are required to have an operational plan for any Halloween activities, and they must keep a list of participants, and physical distancing must be ensured. Door-to-door trick-or-treating is permitted if public health advice is followed, and if your children in your household do go door-to-door, they should avoid contact with anyone in your family and friend bubble who is at higher risk for several days following Halloween. So, and also just regular safety messages around Halloween are also on our website. So there you go.
Ms. Hogarth, do you have a follow-up today?
Just a quick follow-up. I'm wondering if Doctor knows approximately how many New Brunswickers at this point have received a flu shot?
I'll get back to you on that, Vicki.
Okay, thank you.
Thanks.
Serge Bouchard, Radio-Canada.
C'est une question pour le Dr. Russell. Alors,
Oui.
Dr. Russell, concernant l'éclosion ici dans la zone 5, la zone du vestibouche, comment j'aimerais vous entendre élaborer sur les raisons selon pourquoi cette éclosion-là n'est toujours pas sous contrôle.
Alors, c'est parce qu'on continue à avoir des nouveaux cas après le phase orange était mis en place. Ce ne sont pas toujours des contacts étroits qu'on savait qui étaient déjà à la maison auto-isolés quand ils ont été diagnostiqués. Ça veut dire que les nouveaux cas sont des gens qui n'ont pas nécessairement tout été liés aux éclosions à ce moment-ci. Alors, c'est le nombre de cas et c'est la transmission qu'on voit dans des différentes situations comme à la place de travail ou dans les situations sociales. Les collègues, les staffs, l'un de l'autre qui portent pas des masques, qui restent pas 6 pieds de distanciation physique. Alors, c'est plusieurs choses ensemble qui donnent que on continue à avoir des nouveaux cas, on continue à avoir la transmission dans différents endroits et on continue à être que c'est encore nécessaire de faire beaucoup de traçage des contacts. Je crois que le premier ministre a dit que pour chaque cas, il y a environ 20 contacts étroits. Ça veut dire que les gens ne sont pas dans des petites bulles, soit à l'école ou à leur place d'emploi ou à leur maison ou à des endroits où ils peuvent être avec d'autres gens dans les rassemblements. Alors, c'est ça. Alors, c'est parce qu'il y a plusieurs cas, ça continue, la transmission est dans plusieurs endroits et le traçage de contacts étroits et ça continue à dérouler. Et on voit que des gens dans les situations de transmission ne portent pas leur masque et ne suivent pas les directions sur la distanciation physique.
Merci, docteur. As-tu un suivi, M. Bouchard?
C'est tout, merci.
Merci beaucoup. John Chilbeck, Daily Gleaner.
Yes, thank you. It's a question for Dr. Jennifer Russell. My understanding is the city of Moncton and Dalhousie University have started sampling their sewage to see how widespread COVID might be in the Moncton community in Zone 1. So I was wondering if you've had those results and how useful would it be to have that sort of sampling done in places like Campbellton Zone 5 for tracking asymptomatic carriers, so you'd have a better idea of what's going on out there.
So we're currently assessing the feasibility of that kind of an approach in New Brunswick, and that had been discussed at the federal level several months ago. We are aware of the pilot project that's underway between Dalhousie University and the city of Moncton, and we will look into what findings they do have when they're able to share them with us. So thank you very much for that question.
Mr. Chilbeck, do you have a follow-up?
Yes, I guess for Premier Higgs, I'd like to know if this has caught his interest, this idea of testing sewage, so we have a better idea of what's going on, how widespread, COVID actually is, because, they've done it in places like Ottawa where they've been able to track over time just how widespread the virus is in a community, because it also asymptomatic carriers when you can't widespread test. So is the province of New Brunswick, are you interested in having that testing, that sort of sewage testing done in more communities?
Certainly, I would be interested in any activity that would help us to have better understanding of the spread. We've said, I think, about 30% can be asymptomatic carriers. And so the idea of us having a new method of tracking would be certainly useful. I think that goes in line with anything like the rapid testing programs that are used in some areas that we are learning more about every day. I think all of that is helpful. So any activity that gets supported by Public Health and Department of Health is worth considering, and any programs that are under evaluation are ones that we certainly want to learn the outcome.
Thank you, Premier. Tim Roselle, Global News.
Hi there. My question is for Dr. Russell. Dr. Russell, can you confirm if another school in Zone 5 has confirmed a positive test?
My understanding is that there are positive cases at 6 schools and possible exposures at 7 schools, but that could be related to a student or it could be related to a staff member, whether it be a teacher or otherwise. And it doesn't necessarily mean that the exposure happened in the school setting. It could have happened outside the school setting. So those are just the affiliations in terms of where there has been either exposure or a case identified.
Mr. Roselle, do you have a follow-up today?
Yeah, and either Dr. Russell or Premier Higgs could answer this one. That would be fine with me. Just wondering, in Dr. Russell's address, she said barring any setbacks or any changes, the Zone 1 would go back to a yellow phase on Thursday, and the Premier confirmed that. I'm just wondering what would it take for that to be put on hold, that plan to be put on hold?
So we are in very close contact on a day-to-day basis, several times a day, with our medical officers of health as well as our epidemiologists. So if we see a spike in cases, if we see some unlinked transmission, again, we're just going to keep a close eye on what's happening in that area right now. And between the medical officers and our epidemiologists, we'll be continuing to make risk assessments so that if on the day of when we're supposed to go back to yellow, that we are confident that we've done everything that we need to do, and that no new cases pop up that we weren't expecting.
Thank you, Mr. Roselle. Doctor?
Thank you.
Oh, is Vicky Hogarth still on the line? Because I do have the answer for her around the doses of the vaccine that have been distributed. So I don't know how many people have actually received the vaccine, but we distributed 268,000 doses, and 45,000 additional doses should arrive any day now. So that's more than 400,000 doses that have been ordered this year.
Thank you, Dr. Tom Bateman, Times and Transcript.
Good afternoon. Firstly, for Dr. Russell, I wonder specifically for the residents of Manoir Notre Dame in Moncton, who I believe are nearing the end of their 14-day period after the declaration of the outbreak. How will life change for them in terms of restrictions and how they can move about? Can they have visitors, that sort of thing, specifically for those residents?
Well, I can only make an assumption at this point, Tom, around once the yellow phase is back in place, how quickly that things can operationalize. I'm not sure if they will operationalize that immediately, but certainly between social development and public health and the facility itself, they probably will make some decisions around that.
Thank you, Doctor. Mr. Bateman, a follow-up?
Yeah, sure. I believe the Premier mentioned a distinct possibility of more restrictions in Zone 5. Just wonder what those restrictions are. Well, like, is the next step the red phase and all of those protocols, or is there some interim kind of restrictions that could be put in place? And when could that happen? What triggers that, I guess, in Zone 5? Thanks.
Well, I'm having lots of discussions with the regional medical officers of health, deputy chief medical officer of health, as well as our epidemiology team, which includes now a field epidemiologist from Public Health Agency of Canada. We are very, very concerned about Zone 5. We are very, very concerned that the measures that we put in place currently haven't really done what we had hoped would happen in terms of getting things under control and containing the outbreak. So it's all about containment. We're not seeing containment at this point. We're seeing continued spread. And the type of spread, if it's all linked, great, but we do have some cases that are under investigation for community transmission at this point in time because they haven't been linked, and that is one of the triggers, as you know, to go to red. So we do have some more contact tracing to do. We do have some more investigating to do before we would make that recommendation, but certainly the procedure that would be followed is we would do our risk assessment based on the information that we get from our contact tracers, and then we would provide that information to Cabinet.
Thank you, Mr. Bateman. Erica Butler, CMHA, Sackville.
Hi there, thanks. In terms of Zone 1 going back to yellow on Thursday, I just want to be clear, does that mean that barring any announcements to the contrary on Wednesday, people in Zone 1 can wake up and go about their days under the yellow phase?
No, I think the decision will only be made on Thursday because we really have to have that 14-day, that incubation period to make the decision. But certainly the Cabinet already made a decision that if everything went well and that by next Thursday, if there hadn't been anything that would change our risk assessment, that we could go to yellow that day. So the announcement would be made on that day. Thursday would be the day we would announce, but the last of, the risk assessment for that morning would be the determining factor. And that's what we bring to Cabinet, and that was what we would be announcing.
Okay.
Do you have a follow-up, Ms. Butler?
Yes. Now, the Premier mentioned that mask wearing was up to 90% before the mandatory mask rule. There was a range of percentages that he gave. I'm wondering if there is a range of percentages of buy-in mask wearing across the province now.
Yeah, we saw an average before of about 36%. The range was like 15% to I think a high, maybe 60 or 65 or 70. And now we're seeing, I don't know what the low, but it would be more probably in the order of 65, 70 and a high of 95. But the overall average is certainly well up, as I said, into 90%. However, there are pockets of very much of a concern, and certainly the Hamilton region poses that one of those pockets where our surveillance would show that there's areas that are certainly not adhering to the current rules, maybe not even adhering to the previous rules. So now we have a situation where the orange category and the concerns about ramping that up a bit are very real. So we're asking people to really go above and beyond to watch what they're doing. We're going to increase surveillance in that region. And I think the point of, saying how do we encourage people to adhere to the guidelines? Well, it's for their own protection. It's for the protection of others around them. It's to ensure that we have the capabilities to meet the requirements for individuals when they need them. And we need adherence. And we will have to look at what steps may be necessary to ensure that we get a higher compliance level.
Thank you, Ms. Butler. Bobby Jean McKinnon, CBC.
Yes, hello, Premier Higgs. Still convinced the Coalition for Seniors is calling on the government to bring in the military or Red Cross to assist at the Manoir Notre Dame in Moncton. She says families are concerned about the conditions there during the outbreak and that there aren't enough staff. She's also calling for an independent inspection as soon as possible. What can you tell us about the staffing levels there, and how do you respond to her request?
Well, Dr. Russell may want to comment on this as well, but I think given the announcement today, we feel that the Manoir has certainly, dealt with the situation effectively. They've certainly reacted. The control of spread has been corralled in that special care facility, and I don't see a need for the military or measures that would go to that level at this stage. And I think that the lessons that we've learned in any of the outbreaks are certainly what we found, and we're doing analysis around the province and looking and working with each other in best practices. I think the Manoir situation certainly seems to be well under control. There may be areas to look at in the future in several categories, whether it be nursing homes or adult residence facilities or other, but right now, I don't think we need to go to another level, especially given their announcement today to go back to a yellow phase in Moncton.
Ms. McKinnon, do you have a follow-up?
Yes, thank you. Dr. Russell, today in your op-ed, you say that you won't name names or provide identifying information about the source of the Moncton outbreak, which is travel-related. But just to clarify, no media outlet has ever asked us to do that, nor would we. All we've asked you to do is confirm whether the traveler failed to isolate or was exempt from self-isolating. So will you answer that now for us?
Well, again, I feel like because of the nature of the outbreak, the confidentiality around that, I think the person could be identified, and I wouldn't really want that to happen.
Thank you, Ms. McKinnon. Wildenette Paul, Radio-Canada.
Bonjour Bruce, merci beaucoup. Ma question est pour Dr. Russell. Bonjour Dr. Russell. Alors ça concerne le port du masque à la garderie dans les aires communes aux enfants de 12 ans et plus, dans les zones oranges. Donc le Nouveau-Brunswick a imposé le port du masque. J'aimerais savoir comment le Nouveau-Brunswick justifie scientifiquement cette mesure imposée aux enfants. Alors cette mesure est-elle réellement applicable et efficace pour les jeunes?
Alors, merci pour la question. C'est quelque chose on est au courant qu'il y a des changements au niveau national avec l'Agence de santé publique du Canada très récemment au sujet des masques, le port de masque pour les enfants âgés de 2 à 5 ans. Alors, j'ai donné cette information à notre équipe de santé publique et on va en discuter. Et si on a d'autres changements pour les garderies, on va les partager. Mais je suis au courant qu'il y a eu vraiment des changements récemment. Je sais qu'il y a aussi il y avait aussi une différence entre l'organisme de santé mondiale aussi avec l'Agence de santé publique du Canada. Alors, comme je dis, nous sommes au courant à ce moment-ci et s'il y a des changements à nos directives, on va les faire.
Merci. Mademoiselle Paul, as-tu une suivi cet après-midi?
Merci Bruce. Oui, question de suivi. Toujours pour vous, Dr. Russell, vous avez parlé de l'OMS qui conseille justement que les enfants âgés de 5 ans et moins ne devraient pas être obligés de porter le masque. Il y a certains experts aussi qui considèrent que pour les plus jeunes enfants, ils ne peuvent pas manipuler le masque de manière à conserver son efficacité. Ça peut même devenir un facteur de risque. Donc, comment le Nouveau-Brunswick justifie scientifiquement parlant? Donc, sur quels critères, quelles données probantes sa position? Comment on la justifie?
Alors, oui, je comprends la question. Il y a différents endroits qu'on a pris les recherches pour informer nos décisions et certainement l'aspect de la surveillance des enfants de 5 ans ou moins quand ils portent leur masque est vraiment important. Alors, comme je vous ai dit, je suis au courant qu'il y a des différences entre des nouvelles directions, des nouvelles directives qui viennent juste d'être, je viens juste d'être informée la semaine dernière, je crois que c'était jeudi. Alors, comme je vous avais dit, je vais discuter avec mon équipe, on va réviser nos directions pour inclure les nouvelles directions de l'Agence de santé publique du Canada et on partagera les nouvelles quand on les a.
Ici Lauriane Croteau, Radio-Canada.
Oui, bonjour Bruce, merci. La question est pour la docteure Russell. Mon petit, c'est par rapport au masque pour les bambins. Selon l'arrêté d'urgence du 15 octobre, donc la semaine dernière, le port du masque ne s'applique pas aux enfants de moins de 2 ans, ni aux enfants de tout âge dans un établissement d'éducation préscolaire ou de garderie. Donc, pourquoi est-ce qu'on ne mentionne pas la règle imposée dans les garderies en zone orange?
J'ai pas compris toute la question, mais je crois que c'est la différence entre la zone orange et la zone jaune pour le port de masque dans les garderies pour les enfants âgés 5 ans ou moins.
Non, en fait, c'est pourquoi est-ce que c'est pas mentionné dans l'arrêté d'urgence du 15 octobre, le fait que les enfants en garderie doivent porter le masque?
Il faudrait que je m'informe là-dessus parce que je ne savais pas que c'était dans l'arrêt d'ordre. Ben, je vais m'informer, puis je pourrais revenir à cette question.
Vous êtes as-tu un suivi?
Oui, ce serait juste une confirmation. Donc, si la région de Moncton revient à la phase jaune ce jeudi, j'imagine que les enfants de 2 ans et plus vont plus avoir à porter de masque dans les aires communes des garderies?
Je vais m'informer là-dessus aussi parce que l'ordre qui indique qu'il faut porter des masques, c'était dépendant à quelle phase que vous étiez dedans. Alors, il faudra que je m'informe sur les directives sur ce qui arrive dans la phase jaune, mais je crois que vous avez raison, mais je vais confirmer.
Merci beaucoup, Mlle Croteau. Jonathan McKinnis, CTV.
Hi. I also have a question regarding staffing at the manoir for Dr. Russell. We're hearing from the Coalition for Seniors that there are cases where individuals in that home have gone days, if not weeks, without having their bedding changed. They're receiving cold meals. Is that something that you are hearing as well? Can you confirm that? And if that is the case, why have organizations like the Red Cross not been brought in?
Not to my knowledge at this point in time. I think within the first 24 hours of the outbreak having been declared, the prompt team that was sent there to take over the outbreak in terms of incident command and all the staffing support that needed to be there. So they would have had personal care workers, LPNs, nurses, social workers, respiratory therapists, etc. It probably, within the first 24 hours of the outbreak being declared, I can see there being gaps, but once they were established, my understanding is that all the things that needed to be done to look after the residents in that facility were being done.
Mr. McGinnis, do you have a follow-up?
I do. Does Moncton, does Zone 1 have to have 0 cases leading up to Thursday to move into yellow?
I will reconfer with my regional medical officer of health there, but my understanding is that if we don't see any unexpected new cases, so if they were already on our radar, they were self-isolating when they got diagnosed, there's no risk of transmission because they were self-isolating at home at the time of their diagnosis, therefore there is no way for it to be transmitted to anybody else. That's my understanding, that we'd be comfortable and confident when we do our risk assessment at the end of that 14-day period to recommend going to yellow.
Thank you, Mr. McGinnis. Pascal Rachnog, l'Acadie Nouvelle.
Oui, bonjour. Ma question est soit pour la Dr. Russell ou M. Higgs. Je veux juste savoir si tout va bien et qu'il n'y a pas de changement et qu'il n'y a pas une flambée de nouveaux cas d'ici à jeudi. Si je comprends bien, les entrepreneurs peuvent ouvrir leurs entreprises vendredi matin. Donc, pas jeudi, mais vendredi matin. C'est ça, le changement, ce serait dans la nuit de jeudi à vendredi, comme la dernière fois?
C'est ça que moi je comprends. C'est ça, oui.
OK.
OK. Suivi, M. Rachnog.
Oui, par rapport à ce qui se passe dans la zone 5, ma question est pour le premier ministre. Est-ce que il est possible que le gouvernement commence à imposer des amendes dans le Restigouche si la situation ne s'améliore pas au cours des prochains jours?
Yes, it is possible. I think if we're having, serious violations of what should be an obvious, very sensible approach to protecting each other, we have to look at next steps in order to minimize exposure. And I'm hopeful, as we've said leading into this, that we want people to do the right thing and do it on their own and take responsibility, because that is indeed what it's going to take. I did want to reference back a little bit about the discussions about the Manoir Notre Dame. This situation that we've seen in this adult care facility and what we've seen in the Campbellton region as well in the facility, they've been well looked after. This is not a situation in any way, shape, or form like we've seen in other parts of the country. So I think that we can hold our heads high about how our facilities are being run. And sure, there's always opportunities for lessons learned and how do we get better. And because life with COVID is certainly a relatively new situation, albeit let's say 8-9 months. So let's not make this something that it's not, but let's recognize the actions of what it could be and how we mitigate that. I think we've seen excellent response from our facilities and our owners and operators, and throughout our nursing home operation. So let's keep this in perspective while at the same time understanding the level of risk that exists and the way that we can effectively mitigate the risk. We can learn from what's gone on elsewhere, and we can learn from what's happened in New Brunswick. But that is currently certainly being managed by the operations of the independent or the various facilities.
Merci, Monsieur le Ministre. Merci, Monsieur Rachman. Jordan Gill, CBC.
Yes, this question is for Dr. Russell. Why is it taking so long to figure out the source of the Campbellton outbreak? And are you saying the recent cases are the result of community transmission?
In the last several days, we've had 2 cases where we're still not sure what the if they are in fact linked to the existing outbreak. So we do have some more contact tracing to do in that outbreak, and that's ongoing. But what we are seeing is that social gatherings are a factor. We are seeing that interactions in workplace settings are also a factor. So at this point in time, while we're continuing to do our investigation, we want people in the public in Zone 5 to wear their masks, to physically distance. You know, they really, really need to limit their close contacts at all, as much as possible. So we need everybody working together right now to help the situation, because it really is concerning that we're continuing to see ongoing cases. So we do want people to download the app. There are 8 provinces and territories that are using it, and there are more than 4.5 million downloads so far. So that will also help us with contact tracing. So if you don't already have the app, no matter where you are in the province, we'd like you to get it. And also, if you are a traveler who comes into New Brunswick for work reasons, or you've gone outside the province for work and have come back, we are offering voluntary testing. You just have to fill the online assessment form and you can get tested. We are asking people to do this voluntarily, and it can only help our situation all around the province. With the risk, we know that their risks are elevated all around us in all other jurisdictions. We know that we have about 12,000 people coming into the province every day. We know that in order to protect the population from travel-related cases and an inadvertent community transmission, that everybody has to continue to do their part to protect their fellow New Brunswickers.
Mr. Gill, do you have a follow-up today?
Yes, Premier Higgs, what is your thinking on whether workers who are returning from outside the Atlantic bubble should be required to self-isolate? And I'm not thinking of healthcare workers, but people who might work in Western Canada for a short while and then come back to New Brunswick.
I think you know, it's something that we've been given a lot of consideration over the last few weeks, or let's say months or so, given what we've seen across the country, and now given kind of what we're seeing in parts of New Brunswick. So in the coming days, there will be more about that, but I would say in the next week or so. We started that several months ago in relation to, you know, hoping to be able to open up with the rest of Canada. That was before we've seen the second wave throughout the other provinces that hit really hard. And so it is another effective way to manage what's happening in New Brunswick, and it is something that is under active consideration right now, what next steps should be in how travelers who are working abroad in other parts of the country should be treated when they come back. We want to continue the flexibility, whether that be in the form of more testing or certainly today, my recommendation, and I'm sure, you know, as we would follow the guidelines from public health, is when people are coming from other provinces, and even though they're workers and they're coming home to be with their families, they should exercise caution in terms of following all the rules for public health when they're out, keeping their bubble small. Don't take a risk, because we want to just make sure that we can continue to get control of this outbreak as it exists today. And we want people to do their part in the province. And we know that travel has been the source. To this point, it's all been travel related. So anyone who's traveling has got to consider that they have an extra responsibility.
Thank you, Premier. Thank you, Mr. Gill. That concludes today's update. Thank you. Cela conclut la séance d'aujourd'hui.